Welcome back, Daily Show. What time is it? 9:16 on a Monday. We're in with Brittany Best. Welcome back to the show. It's been almost a year, I think exactly a year.
Yeah. Thank you for having me again.
This is really cool. You know, it's great to have these conversations because, you know, when we're talking about strokes, it just seems like, you know, this really does impact so many of us, whether it's directly or indirectly within our families. And just seeing, too, you know, the amount of what I would perceive to be younger people that are, you know, maybe suffering from stroke-like symptoms and what to look for.
Yeah, absolutely. A lot of people are surprised to, you know, hear that strokes can happen at any age. It can happen to even babies, you know, before they're born, all the way up to, you know, the elderly. So it is really important to learn more about that.
Well, and you know, before we go all the way into that, take us through your background at St. Anthony's and a little bit from what you do day to day.
Yeah, so I am the stroke navigator. What my job kind of focuses on is making sure that our stroke patients have the best possible care. So whether that's being hands-on with when stroke patients come in, I also review charts just to make sure, you know, the best things were happening at the best times. I also get to provide a lot of education to patients, families, and even the community.
Well, and when it comes to the education component of it, I'm sure that really goes a long way because so much of, you know, how we can, you know, maybe combat this and really treat it ahead of time and do the preventative maintenance, you know, whether it's eating right or all that good stuff, but also afterwards, you know, what's it look like on the family and what's that support system need to do too for that individual? Yeah,
absolutely. Education is honestly one of the biggest, you know, things that we can do to prevent because up to 80% of strokes actually are preventable. But, you know, you have to know how to do that. So,
and you know, I want to touch on that here in a little bit. Yeah. You know, as we go into that, what exactly is a stroke?
So a stroke happens when part of the brain isn't getting the oxygen that it needs. So that can happen when a blood vessel is blocked, sometimes by a clot, sometimes by narrowing of the arteries due to cholesterol or plaque, and it can also happen when a vessel ruptures in the brain. So that part of the brain has the brain cells start to die within minutes.
Well, and what surprises me is that I saw that 1 in 4 adults will have a stroke at one point in their lifetime. Is that true?
It is, yes. So stroke is actually it's the 5th leading cause of death in the United States, but it's the number 1 cause of adult disability. Really? Often when it happens, you know, it leads to really disabling, you know, effects, sometimes lifelong.
And I'm sure there's different severities, you know, of strokes. And, you know, when it comes to that, I'm sure, you know, there's different ways that you go about it and treat it, but all of them need to be taken with the same amount of, you know, severity too, and the same amount of seriousness.
Yeah, absolutely. Depending on which part of the brain is affected, you know, that you're going to see certain symptoms. Unfortunately, some, you know, of those are very, very severe.
Well, and can we start with we talk about the severe side, even as, you know, the TIA side of things, what is that? Is that kind of the same thing?
So TIA, it's often referred to as mini stroke. So it is, you will see a patients come in with stroke-like symptoms, but often, or with a TIA, they're going to resolve on their own. Wow. Sometimes it happens within minutes. Sometimes, you know, it can be, you know, a day, but the biggest part is that they resolve, and thankfully there are no, you know, long-term deficits.
And do you still work with those individuals that go through TIA in your role, or is it kind of more of whenever you have a more of a diagnosed stroke?
No, so TIA, we treat it with the same urgency.
Wow.
Often when somebody comes in with a TIA, it can mean that a bigger stroke is coming. So it's really important that we, you know, reach those patients. We treat it as a medical emergency just like we would with stroke, and we focus on figuring out what the cause is so we can get that under control and hopefully prevent a stroke from happening.
Well, and you know, you said earlier 80% of strokes are preventable, and that to me is just staggering. What is it? Lifestyle? Is it, you know, is that really a lot of it? A
lot of it is lifestyle. So what we call those risk factors are modifiable. So they're things that we can change by, you know, how we handle them. So we can't always control that we develop things like high blood pressure, high cholesterol. Sometimes those are, you know, they run in the family or so on. But what we can do is make sure that we are taking our medications to keep those under control, you know, seeing our doctor regularly, having blood pressure checks, those types of things.
And, you know, when it comes to some of the things that, you know, I can't control, if it's, you know, genetic or in our families, you know, just kind of background and medical history, what comes to, that side of prevention? Is it really just, making sure that we're doing everything we can on the medication side of things for whether it's high cholesterol or a cholesterol issue or you name it? Or is it one of those things that you got to do a little bit more on top of just what we're doing on the prescription side of things?
Yeah. Like you said, unfortunately, there are certain things we can't control. With age, everybody's stroke risk increases. Women are at a higher risk of stroke than men. Those people who are at a naturally higher risk definitely need to, focus on the preventative measures.
Before we circle back to some of the things that we can control, this is so interesting when we talk about mental health and well-being, because, and I don't want to joke about it because it really is a serious topic, but, so many times I've heard, you got to quit, yelling because we've heard the adage you're going to have, a stroke or so. Does, mental health and stresses like that, does that play a role in strokes?
It absolutely can. It's not necessarily one of, the primary causes, but what it can do is kind of exacerbate, risk factors that are already present. So stress, can spike your blood pressure. It can cause increased inflammation in your body. And it can also put you at risk for, unhealthier, life choices.
When you are working with patients, what's kind of the age range? I mean, I don't want to get too specific, of course, but do you really see it from all ages?
We truly do. Yep.
Wow. Going back into the things you can control, I'm looking at this too when it comes to, when it may be an AFib issue. Is it one of those things where you really have, when it comes to atrial fibrillation, could that happen kind of regardless of if we're keeping everything under control because it's a risk factor like all of these? Or what I'm trying to get at is if we're hitting all the marks, and we're, making sure that we're taking care of, the alcohol intake, we're taking care of the physical activity, we cut the smoking out. That doesn't really necessarily guarantee that, it's not going to happen to us.
Right. Yep. So AFib can be caused, sometimes just with age, sometimes certain medications. There are different things, that unfortunately are sometimes out of our control that can cause us to develop things like that. But again, one of the biggest things you can do is make sure you're seeing your doctor regularly so they can identify that you have that risk factor and get you started on the right, path.
When you're looking, when we're talking to a general audience, what age do you start to really recommend people really focus on, taking care of not just, stroke prevention, but their overall heart health too?
We are seeing younger and younger patients coming in with stroke and heart related symptoms. So it really, I would, as soon as you possibly can, but the stroke risk does double over the age of 55. So especially in that, category, you really, really want to be careful.
Well, and so I got to ask you, and it might sound like a silly question, but when it comes to, when I think of, strokes and heart attack, I always put them in the same category. I feel like a lot of and they're two separate things, right? Because this one affects your brain and the other one's your heart, correct?
Right. Yep.
And I hate to sound so silly to ask that question, but I think, so many of us maybe correlate the two and it's completely opposite.
Well, they are related as they both deal with blood vessels. The blood vessels in the brain, the blood vessels in the heart. Some people I've heard stroke referred to almost as a heart attack of the brain. So, really. Okay. A lot of the risk factors that cause stroke can also lead to heart attack. So, by getting those under control, you really are, doing good overall for your health.
I'm glad I asked that. It makes me, because I've always wanted to really kind of get the connection there and just the separation of it. And I wanted to go back into the mental health side of things too, because I do find this fascinating because there are things that you guys put in our little cheat sheet here that I do think are really interesting, like chair exercises and things like that. Is that for, for people that maybe have a little bit of time, harder time getting up and moving around, and also the improved lighting in your home? It's things like that seem so simple, but really do go a long way. Yeah.
So especially those who have had strokes, they have to really be careful to prevent injury and falls. So some of those things, like improving lighting in your home, can really make a difference. Chair exercises are a good option to just get the body moving and, put in the exercise that will hopefully help prevent strokes from occurring. And there are a lot of different modifications you can make to, really make your home safe and, make your body healthier.
Absolutely. You got a moment to take a quick break with me?
Yeah. Yeah, sounds good.
I got to pay a bill. We'll come back with more of this conversation right after this on RiverBender.com and Roku TV.
Firearms training shouldn't feel intimidating. At Precision Point Armory in Bethalto, we focus on safety, confidence, and real-world skills. Whether you're new or renewing your concealed carry, you'll get professional instruction without pressure. Learn safe handling, sound decision-making, and proper techniques tailored to your experience level. If you're looking for premium firearms training in the heart of Bethalto, Illinois, call 618-779-9947 or go to precisionpointarmory.net and train with confidence today.
Struggling with depression that just won't go away? At Precision TMS, we offer a non-invasive, drug-free treatment designed to target the areas of the brain linked to mood regulation. Using FDA-cleared transcranial magnetic stimulation, gentle magnetic pulses help reactivate underperforming brain circuits without surgery or sedation. Many patients experience real relief, even after other treatments haven't worked. Our experienced team provides personalized care every step of the way. Contact Precision TMS today to see if TMS therapy is right for you.
Accidents happen in a heartbeat, but lives change forever. Whether it's a car crash, workplace injury, medical malpractice, or wrongful death, you don't have to face the consequences alone. Keith Short and Associates brings over 33 years of experience and a reputation for fighting fiercely for your rights. For relentless representation that you can trust, call Keith Short and Associates at 618-254-0055 today for a free consultation.
What's up? It's Mike Keith. What's up, bro? Back to spotlight other amazing alumni and how they discovered their path at Lewis and Clark. Let's jump into it. This is Tom Wells,
an assistant chief of the Godfrey Fire District. He has been a firefighter and an EMT for over 20 years. Tom is currently an instructor in the Lewis and Clark Paramedicine program and has 2 degrees from LC, fire science and nursing.
I'm Tom Wills, and I'm a trailblazer.
If you think you might be pregnant, you don't have to face it alone. At Vitality Women's Clinic, you'll find the care you deserve. We offer confidential, no-cost pregnancy testing, ultrasounds, and STI testing. Our team is here to listen, support you, and help you understand your options without pressure or judgment. Walk in or make an appointment today. Call 618-466-1690 or visit vitalitywomensclinic.org. Vitality Women's Clinic, clear answers, real support.
Welcome back, Daily Show. Back with Brittany, back with OSF St. Anthony's Health Center. It is Healthcare Week, Healthcare Worker Week.
Yes, it is.
What is that the official name of it? Am I getting this right?
Yep.
Perfect.
Yep.
I just want to make sure we shouted you guys out, or everybody, because you guys have had a good run of things at St. Anthony's. And the last year with the Magnet of Distinction recognition, all the way across the board to the wound care clinic, and the great work that's being done there. You guys are really doing great stuff.
Yeah, absolutely. It's a great place to work. It's a great place to, seek treatment. It's really just a good place all around.
Well, and as we're getting back into just discussing, strokes, and as May is Stroke Awareness Month, let's talk about F.A.S.T, because, that is something I do remember the last time you were around the show. What's that stand for again? And, how important is it to really stay true to that acronym?
It is extremely important. If there's one thing that you can take away from this, I would, say that would probably be it. So we use the acronym F.A.S.T to identify stroke symptoms. So I can just run through the letters real quick with you. B stands for balance. So if anybody were to have a sudden loss of balance or dizziness, that would be very concerning. E is for eyes. So there may be a sudden loss of vision or blurred vision that can happen in one or both eyes. Mm-hmm. F is for facial drooping or facial weakness. So you may, you can ask somebody to smile. If that is uneven, that would be very concerning. A is for arm weakness or numbness. S is for speech difficulty. So there we're looking for slurred speech or maybe difficulty finding the words. And then T stands for time. So if you have any single one of those symptoms, it's time to call 911 right away and get to the hospital.
Well, and see, that's where I find it, so important too, because, how many times do we have the end of, and it's me for sure. If I have something that, people are like, hey, you need to go get this, looked at right away. I'm like, I'm just tired, or I just have this going on. And it really is a matter of minutes when it comes to this sometimes too, right?
Absolutely. We're all guilty of that, on occasion. We want to, kind of brush things off, but I cannot stress enough, if you have one of those symptoms specifically, or if it's anything brain related, you have to get to the hospital right away, because millions of brain cells can die every single minute during a stroke.
Wow.
Yep.
And let's say, someone does get to the point where they do have a stroke and it happens. What's life look like after that? Because I know that we've talked about, the different ranges of severity and how those paths look different for everybody. But, does it all kind of have the same kind of rubric?
So there are all different types of, severity of strokes. Hopefully if somebody does have a stroke, they have mild symptoms and, can maybe, live somewhat of their normal life. Unfortunately, that isn't the case with everybody. And there are a lot of people who do have very, disabling deficits that can be lifelong, and that can lead to maybe them not even be able to care for themselves on their own. It can even lead to death. So it's very serious.
Well, and it seems like it's one of those things where the more serious you get, and really at all cases of a stroke, that you really need to have a good support system around you to get through the whether it's a couple of weeks, months, years, or honestly, sometimes the rest of our lives, unfortunately.
Yeah, absolutely. Having, a good support system will absolutely make recovery, more possible. Whether it's family, friends, there's a lot of community resources. There are, support groups like the one that we offer at St. Anthony's for stroke. So
we'll talk about that here in a second. And when it comes back to your role as a navigator, what's that conversation look like? After someone has a stroke, do you guys go? Is there a severity chart or something that you guys look at that you base it upon? Or what's that? I'm just fascinated by what that process is.
So when we have a stroke patient in the hospital, they are seen by lots of different teams. So physical therapy, speech therapy, social services, everybody kind of jumps on board and tries to figure out the best possible plan. They get assessed to see what their, physical, functional ability is moving forward. And they, really develop a plan on how to, make that better.
Interesting. When it comes to before we go into your support group, I do want to talk about things at, home, because so many times, and I went through this, not with a, stroke, but with, my grandpa getting older, and we're trying to figure out, what is the best thing even to, eat with? Is the spoon too, thin? Can you hold it? All that stuff. When it comes to solutions around homes for modifications, whether it's for preventing falls or, any of the day-to-day activities, are there, any way that you can kind of help us with simple solutions that don't necessarily, maybe break the bank or, necessarily run through an insurance per se?
Yeah, absolutely. Some of the biggest things you can do around your home for safety are, removing rugs. Loose rugs are a huge cause of falls for not only stroke patients, but anybody. Keeping the walkways clear of clutter. I know we mentioned earlier improving lighting in your home. Keep frequently used items within reach if you do have, issues with mobility. Grab bars are, a really nice thing to have around the house as well. And sometimes those are covered by insurance there's even community programs that offer, to come into your home and make it safer for you. There are a lot of resources for the community.
Fantastic. And you also have a great resource, too, on the third Monday of each month from 4 to 5, and that's at Alton Square Mall.
Yep, it's our stroke support group. Like I said, we have it each month, and it is a kind of an educational group. We really meet. We have great conversation. We have a lot of guest speakers come in and kind of touch on fun educational topics. It's really good, honestly, just for the connection with others. The conversation is great, and we do invite anybody who may be interested to join us.
Well, I think it's really important, too, because, it's one of those things where I feel like you need to have a shared connection to truly, get to really feel heard in that situation. Because if you're going through, maybe you're supporting your loved one or your husband, wife, you name it, that child that has a stroke, I don't feel like anyone that's not going through that can truly connect. And so to really share tips and maybe even, hey, here's what we're going through at home. Do you guys have any suggestions? I think the shared and lived experience is really vital to the success of not only the group, but, for the mindset of the support group for that individual.
Yeah, absolutely. There are statistics even that, say joining a support group after a stroke, or whether you're a caregiver or, a survivor, can actually really improve recovery. So that connection is a huge, it has a huge impact.
You can RSVP or get added to the mailing list by calling 618-463-6393. That's 618-463-6393. Also, too, take us through some other resources that are available maybe for all of us to gain better understanding if we have a loved one or ourselves that are going through this. Yeah.
So you can start by, looking at the OSF Healthcare website. It is osfhealthcare.org. There's a lot of good resources on there. You can also check out the American Heart Association / American Stroke Association. They have excellent free resources for caregivers and survivors. And it's always great to get set up with a primary care if you don't have one, and they can really connect you with a lot of resources as well. And you can contact the OSF Medical Group. I believe they are accepting new patients right now, and the number to do that is 618-462-2222.
We're on the website right now for OSF Healthcare, and you can also, for all your needs, you can click on locations. You can find the St. Anthony's Health Center location right here in Alton and find the primary care provider. You guys have a great network throughout the coverage map you have, but back here just locally, from the prompt care, your guys' prompt care office is literally the best and does such great work. But your doctors really are just a great team. You have a great staff, and really the system which we operate is like a machine. It truly is becoming really fine-tuned.
Yeah, our providers are excellent. I hear really, really, really great things about them. They're just welcoming. They take the time to listen, and that just makes a huge difference in patient care.
Absolutely. Brittany, thanks so much for stopping by.
Yeah, thank you for having me.
At 9:38, we'll take a quick break, and we'll come back with more Daily Show right after this on RiverBender.com and Roku TV.